So when you arrive to do treatments at the nursery, you'll be provided with a printout of every treatment that's due for that day. The printout will have the kitten's ID number, name, kennel number, the treatment that's due, and also the date that the treatment was due on. So any treatment that says serum, you will not be given. This is a responsibility of the medical team. And then you will be giving microchips, dewormers, Advantage, FVRCPs, and you'll be drawing blood for feline leukemia tests. So we're in Queens and Kits right now, so we're going to turn to the Queens and Kits page. And there are a couple of kittens that are due for treatments down here. So Sully is due for Stranded Panazerol, which are the dewormers that we use, and his FVRCP, which is the vaccine that we use. And the other kitten that lives with him is also due for the same things. So the first thing we need from them is their current weight, which will be located in their folder. So in Queens and Kits we have a binder, and in other sections we have individual folders. So Sully's current weight today is 681 grams. So I'm going to write that down. And you need that weight for the dewormers. The vaccine is just a standard amount for every kitten. And then for Gnocchi, we have a weight of 816 grams. So I'm going to get their vaccines ready first, so I'll show you how to draw those up. Vaccines are located in the main refrigerator at the nursery, so you'll find them in a tray that looks like this, and you want to make sure that the vaccine says what you want. So right here on the side it says feline rhinotracheitis, calici, and panleukopenia vaccine. So that's what the FVRCP stands for in that vaccine. So to prepare the vaccines, and like I said, they have to be kept in the fridge when you're not using them. We're going to draw them up in a 3cc syringe with a needle already attached. You'll either find those syringes in your section on a cart, and if you can't find any, they'll be under this area right here. So you're looking for the 3cc's with the needle already attached, which is what is on this box. And these are kept in the packages to make sure that they're kept sterile. Which makes them hard to unwrap. So the first thing you're going to do is draw up the sterile dilute. This is a liquid, and this is going to be drawn up into the syringe, then pulled into the powder, and that'll make the liquid vaccine that you're going to give to the kitten. There's about just over 1 cc of liquid in here. So you pierce the top with the needle and then draw back on your syringe until you have at least 1 cc of liquid, and usually there's even a little more in there. And then the liquid goes into the one with the blue on the top of it. So you just pierce it through the middle, push down, mix, and then you have a pink solution, which is the vaccine. And then you draw that back out into the syringe with the same needle. And like I said, it's usually right around 1 cc. Sometimes you get a little more. So you see right here, we have 1.1 in there. So if you're only drawing up 0.5, it means you didn't get all the liquid out to mix it. So make sure you have about this amount in there. So your needle is now dulled. You've poked the top of this, you've poked the top of this, and they're quite thick. So you don't want to try and poke through a kitten's skin with this dull needle. So you're going to twist it off and dispose of it in a sharps container, which over here is right here. There's also one in each section at the nursery. And you're going to put a fresh needle on the top. So the needle tops are kept here or in the section you're in. And I'm going to use a red top needle. This is a 25 gauge needle, so it's quite a small size because we're dealing with kittens. We're not dealing with large animals. And these are sterile when the plastic is still on them, so you snap it off and twist it on. And you don't want to put that down on any surfaces because you don't want any bacteria or anything getting in there, which could then be passed through the needle. And I'm going to drop, and you can place it down while it's capped. So I'm going to drop one more because we have to give it to Scully and Noki. So I'll do one more. I'll do this one a little bit quicker. You can see there's still a little liquid in there and I'm not quite at 1, so I'm going to make sure I get that all out of there. And then into the one, again, the powder with the blue on the cap, mixed, and then drawing it back up into the syringe. And then I have right around 1 cc of liquid in there again. And then I twist off. There we go. So we have our 2 vaccines ready to go. And then any trash, there's always trash cans in every section. And also your little glass vials, these can also just go in the trash. And then make sure that you put your vaccines back in the refrigerator. Really, once they're drawn up and out the fridge, you need to use them within 30 minutes or they start to lose their efficiency. So I wouldn't draw up 50 vaccines at the same time. I would draw up a few, make sure they get in the kitten, and I draw more up later. So these ones are going to go back in the fridge. To administer the vaccines, you're going to wear gloves. Just like everything else you do at the nursery, it's important to use disease control with everything you do. So put your gloves on, and I have my cart ready with a pillowcase on top so I can place the kitten on the pillowcase. Some people get into the habit of placing animals into their laps or just holding them against them, and that could be a break in disease control. So we have carts in each section that are available just for treatment use and medical use. So make sure you take advantage and you use these carts. So the 2 kittens I'm going to vaccinate are right here. This is Sully and this is Noki down here. So I'm going to do Sully first. He's very eager. Hi, buddy. Come here. So this is a big kitten. This kitten has already had a vaccine on board. They get their first vaccine when they're 5 weeks old. And this little guy is 7 weeks old. So this is his second vaccine. He thinks he's getting fed. Anytime kittens come out, they think it's food. So they're very excited. So you're just going to gently hold, and I'm going to vaccinate just over his shoulder right here. So I'm going to uncap my needle. Once your needle's uncapped, do not place it down anywhere because that will mean it is no longer sterile. And then just over the shoulder, I'm going to gently hold the skin. Make sure your needle is bevel up, which means it looks like this. So the flat area of the needle that comes down to a point is facing up and not downwards. So that is bevel up. And then you're going to gently hold the kitten over the shoulder, insert the needle, and usually it's a good idea to pull back a little bit on the needle to make sure you're not anywhere you're not supposed to be. And I'm getting nothing, so I'm going to gently push down, and he's being a little feisty, which is normal. And then you saw a tiny bit at the end came out. Usually if they get about half of the vaccine, it's still going to be effective. I'm just going to make sure I wipe this off of his coat. Come here, buddy. So when you have a wiggly kitten, that is most likely going to happen, especially when you're first learning. So now he's got his booster FVRCP vaccine, and I'm gonna vaccinate his buddy too. I'm gonna do the same for this kitten. So when the needle's off, bevel up, and hold over the shoulder, insert the needle, pull back a touch, and then go ahead and vaccinate right there. And I usually just hold off a little bit after to make sure it doesn't run back out. And he's good to go. So once I'm all done, you can twist off your needles. Your syringes can go in the trash, and your needles will go in the sharps container. So once you've given a treatment, it's important that you mark it off on the sheet. You won't always be entering these treatments. Someone else may be doing it for you. So I always do a little check mark once I've given the treatment and make sure that that's communicated to the person that's entering them, so we don't end up double vaccinating or them skipping that vaccine. And the same over here. So the same two kittens need their dewormers. Usually I would prepare everything before I give them for the purpose of training. I've been doing it step by step, but usually if it's the same kittens that need treatments, you would have everything prepared and ready to go for them. But we're going to draw up their Strongid and Panazerol, which is located, if you're in Queens and Kids, it's in the big white fridge. If you're located in Quarantine A and Quarantine B, you have some in your small refrigerator in those sections. So I have their weights that I need. There is a document at the nursery and a tab that says treatments, and it does have a cheat sheet on how much Panazerol and Strongid to draw up for the weights. So these are accessible in the training binder. So my first kitten is 681 grams. So I'm going to give him 0.3 of the Panazerol and 0.1 of the Strongid. You can see the dose guidelines there. So for the Panazerol, I usually round down rather than rounding up. So I need a 1 cc syringe. And then in my fridge, I have a large container of Panazerol. They sometimes are in smaller containers. Everything is labeled with the dosage and the expiration on there. And then Strongid is yellow. It actually doesn't need to stay in the fridge, but Panazerol is the white one. It has to stay refrigerated. Just for ease, we keep the Strongid in the fridge as well, just so that we don't forget and put the Panazerol away as well. Okay, so we have the Panazerol and the Strongid, which is yellow. So for Sully's dose, we said that he would get 0.3 cc's of Panazerol, which is the white one, and he would get 0.1 of the Strongid. So just to clarify, 0.1 goes down to here. That does not mean 1, which would be an overdose. So we have 0.1. Now you can give the kittens too much. It's not harmful to them, but just please be mindful, and the 0.3 would be to here. So I actually use the same syringe for both dewormers just to save money on syringes. So as long as you can do a little math, it's pretty easy to do. So I'm going to draw up 0.1 first of the Strongid. And then the syringes fit perfectly into the Yorkers. And then I'm going to draw back and make sure it's right around the 0.1. And then I know the kitten needs 0.3 of the Panazerol. So I'm going to make sure that in total we'd have 0.4 in this syringe. And then if you are not confident doing this, you can use 2 syringes and draw them up separately. So I'm just going to draw it back down to 0.4. And because they're mixed in here, you shouldn't express it back into the bottle. You should just keep it pulled back in the syringe. And then I'm going to cap off my syringe. And then what you can do is you can label the syringe with the kitten's name so that you don't get them confused. For these kittens, there's only 2 of them, so I know, but I suggest if you're drawing up a lot at the same time, you would label the syringes appropriately. So for Noki, who is 816 grams, we're drawing up 0.4 of the Panazerol, and again 0.1 of the Strongid. So this will go all the way down to 0.5. So the one with less is for Sully, the one with more is for Noki, and just to remember, the Panazerol absolutely has to go back in the fridge afterwards. So I'm putting my gloves back on just to make sure for disease control. I'm not holding the kittens with bare hands, and I'm going to grab my kittens out again. Okay, so this is Sully, who gets the least because he's lighter in weight, and then he thinks he's getting fed still, so he'll probably want to eat really quickly. So he ate up his dewormer. They don't all do that. Sometimes they spit it out and you have to make sure you wipe their faces after, but he ate it all up really quickly. Okay, it's Noki's turn, and he was getting the 0.1 of Strongid and 0.4 of Panazerol, so here goes. Down the hatch. Hey, kitten. Good boy. And then your syringes are going to go in the trash when you're done with them. So these 2 kittens are done with their treatments. They don't need anything else today. So I'm going to make sure I put their pillowcase in the laundry and disinfect my cart once I'm done. And then I'm going to mark off that they got their treatment.